On the right, in the Crossfire tonight, Ruth and Grover Norquist. President Obama's apology for the mess he's made on health care is just the latest example of him thinking he can just talk his way out of a problem. As for his claim he's willing to work with Republicans, well, I'll believe it when I see it. It's an empty promise, yet it's one he keeps making over and over.
As I've said many times before, I'm willing to work with anyone on any idea who's actually willing to make this law perform better.
This is pure pageantry. Who exactly does he intend to work with? As for this president's relations with members of Congress, he either doesn't have them, or if he does, they're horribly strained. And that's just with the Democrats. Ruth, aren't these overtures by the president hollow? I mean, if he hasn't done this for over the last 5 years, what's anybody to believe that he's going to do it now?
Well, hollow or futile, I think, is the question. Not F-E-U-D-A-L, F-U-T-I-L-E, futile. I think you make a fair point that the president has strained relations with the Hill, with Democrats as well as Republicans. It's a fair point that he has not put enough effort into building those personal relationships. What's not a fair point is the notion that he has somebody to work with or had somebody to work with all along. Think about it. One of the reasons that it took so long to get Obamacare passed is that the administration dithered and dithered and dithered and twiddled its thumbs so that Max Baucus and Chuck Grassley could come out with some plan. Time after time in the health care area and in other things such as budget negotiations.
He left it mostly to Capitol Hill Democrats.
The president has made overtures to Republicans that other members of his party have just rebelled at.
Well,
I would say change CPR.
On this particular issue,
raising the Medicare eligibility.
Ron Johnson has a bill. Do you think he's going to call Ron Johnson and work with him? Just today we saw reports where he's only going to huddle with Democrats.
Where has been, I'm going to throw your question back at you. I think that's like a good thing in media training. We were talking about it. Where has been the Republican willingness to tweak, fix, save, improve Obamacare as opposed to simply repeal it? Until there is some willingness to do that, it's hard to imagine a common ground to meet on other than, hi, I'm here, I'm President Obama, I surrender.
Look at who exactly the president would be negotiating with. Let's take a look.
Do you like green eggs and ham? I do not like them, Sam I am. I do not like green eggs and ham.
46 votes to defund, derail, or repeal Obamacare. Hundreds of amicus briefs. Who exactly wants to work with the president to improve this law?
Well, 6 laws were passed that the president signed. Republican laws, which took out some of the worst parts of Obamacare, taxes.
Oh, so the president has worked with
Republicans? He has on a number of these ideas. So the idea that the president will only sign bills that make Obamacare worse and worse isn't true. He's actually, in 6 cases, taken Republican ideas. The Senate's passed it. And there'll be a couple more of those because the Democrats have put themselves in a very difficult position. Obamacare is not a complete failure. It won the Republicans the House in 2010. It's going to win them the Senate in 2014. Not too many pieces of legislation have done that much good for the American people since Clinton raised taxes unilaterally in 2093.
Well, let's talk about political implications of this. There are millions of people being denied coverage because of decisions that Republicans are making. Let's take a look at this map.
Because of Obama's law.
No,
take a look at the map.
Governors
look
don't
at the people
care about their poor citizens.
That's not
look at those red states. Take a look at those red states. Those are all states where Republican governors and Republican legislatures are refusing to implement Medicaid. That is 5 million people.
Expand. Explain to people how much do they steal from the American people in federal taxes when the governor gets to say, I'm going to spend some money. What's the ratio of federal money that comes in?
How much do we pay because people don't have health care and they show up at the emergency room? That's $1,000 on your premium, Grover.
First of all,
it's actually costing you. That's a tax on you.
Costs are astronomical.
It is a tremendous increase in taxes on the American people, federal and state, and many states have said no.
Why are some Republicans implementing it then? Actually, many Republicans are implementing it.
No, not many.
About half of states are not implementing it.
Yes, and
Governor
25
Christie,
states.
Governor Kasich.
Governor Kasich.
Okay, well, in the case of Christie, you have overwhelming Democratic House and Senate there. Kasich, I think, has a challenge to do it outside the legislative arena because he didn't have the support. It's not a very popular thing. It's a massive tax and spending increase at the local level.
That some Republicans are doing?
That the president and some Democrats are refusing to do as well. But remember, the president wanted to shove it down everyone's throat and not give them the chance. That's what the Supreme Court said was unconstitutional. So what you're asking is, why are the Republicans doing what the Constitution says and not the unconstitutional thing that Obama and the Democrats wanted?
You're totally right, Grover. The Republican governors, but there's a but here.
It's not necessary to say that after this comment.
Republican governors do have a choice. The Supreme Court gave them the choice. It's to take what, to me, looks like a terrific bargain, get additional coverage, it paid for by the federal government.
For how long?
For 3 years, and then a significant amount continued to be paid for by the federal government to cover the near poorest citizens in their state. The poorest are already covered by Medicaid. This would bump up to 133% of the poverty level. You call that stealing from taxpayers? I call it basic common decency.
Okay, where do you get the money from it? You take it from taxpayers. Why do you always leave out the...
That's what we have taxes for, Grover. We have taxes in order to fulfill the essential role of government. You see,
like the sugar subsidies, very important.
We agree on sugar subsidies. You see the essential role of government as a little bit of defense, and the rest I know you want to put in the bathtub and strangle. I see the essential role of government as broader, including protecting its most vulnerable citizens. Do you want to get rid of all of Medicaid?
Well, two things.
Yes or no?
No, step one. And the next,
do you want to get rid of all of Medicaid?
The next step in terms of reforming Medicare is the Ryan plan. That's on the table. It's not some fantasy about what
Ruth, do you
taking Medicare and block granting it to the states.
Ruth, do you think one of the reasons that the president is apologizing right now is because he knows that there's worse news to come down the road? And when is it that we're going to actually see somebody say that 6 months from now, that if this isn't working, that something big has to be done, rather than just taking little tiny steps to put Band-Aids on a lot of Obamacare's problems?
I think, well, we're not putting a Band-Aid on the website problem. We are, doing triage and major open heart surgery. At what point are you all going to have a sense of self-reflection and say, we have a problem here? At what point does that happen? We have a problem here with the website. I'm not you all. But there is a political problem, not necessarily a substantive problem, but a political problem with the number of people who are being told their insurance is canceled and who don't yet know what their access will be.
That's not a political problem for people that are getting their health insurance.
Well, we don't know how they will end up, because most of them will end up in a better situation than they were before with inadequate insurance.
Ruth, who gets to decide whether they're in a better situation, the individual or the government?
The state.
Okay, well,
the state.
If you are buying a product that you like, and now the government says you can't because this one's better,
we're going to have to go back to the car.
The government's going to decide,
just as Governor Romney and the Massachusetts legislature, you knew I was going to go there, Kevin, decided in Massachusetts that there was a package of
6 million people, not 330 million people.
Okay, but size may matter for getting this thing rolled out. But in terms of imposing a package of minimum benefits, you know that Romneycare and Obamacare are precisely the same model.
Both bad ideas. Both bad ideas passed by a legislature 80% Democrat in Massachusetts.
Well, it's actually almost universal coverage. Costs are going down. I think Romneycare is actually working. Okay, stay here. We're going to ceasefire next, believe it or not. Is there anything that the two of you can agree on? We also want you at home to weigh in on today's fireback question. Did the president's apology matter to you? Tweet yes or no using #Crossfire. We'll have the results after the break.